Most people experience so much violence at a young age that by the time they get older, they desensitized to it.
People are traumatized and they automatically, unconsciously move into fight, flight, or freeze. And if you react with fight, then you're going to perpetuate more violence.
Kansas City is known to operate with innovation. We have strongly adapted the trauma-informed care model, but one of the things that we know from public health perspective is that we need to take that from an individual level and begin to affect community level trauma.
Our mission is to cure violence in the capacity of healthcare workers. We're just trying to show people skills to handle a conflict without resorting to violence.
Violence operates very much like a contagious disease. Luckily, in public health, we also know how to cure those contagious diseases.
We're prone to violence because that's what we hear. We hear violence in our music, we hear violence in our family. You know, the neighborhood we grew up in, it's a violent neighborhood. So that's how we cure violence. And if I'm crying again, so I'm emotional because this is my community.
I have multiple brothers that have been shot, and I want to change from that, and I had a cycle going for me. With me having a son, I want to do better for him and make ways to change what's going on in the community.
When communities recognize that they also have agency and they have voice and their actions can help to build a stronger community, that is one of the things that helps to reduce violence.
We have to love our own community first, and we have to step up.
Even though my church is out in the suburbs, it's important that we heal our city from the inside out. I know churches are doing a lot on their own individually, but what happens if we come collective and we have the same strategy, the same way to attack violence before violence even happens?
I believe the success to monitoring what we call a violent situation is really bringing in community members that have those resources available to help out. If we do that as a collective body, I think we would be more successful than we could imagine.
Criminal justice does not mean public health is excluded, or violence prevention does not mean that criminal justice is excluded. But as approaches, we can combine them to create a safe community.
We love Aim for Peace. It's an evidence-based practice. As soon as they get a word that there's a trauma and it's intentional, they will call the hotline for Aim for Peace and they will send someone out. And they come whenever we call.
We have a tremendous relationship with the police department because they are close to us. They attend our meetings.
When we're all working together, we are moving toward one goal. That one goal is to be able to create vibrant, healthy communities.
People who've been traumatized have had their choices taken away, and yet they are the expert on their own life. So you gotta give them that power back and build a sense of mutuality in a relationship.
Our case managers or our family support specialists do a great job with connecting to the families so that they could at least manage the challenges that they have on a daily basis. You can have the best environment in a school building, but if a child comes to school with a trauma, learning will not take place.
Violence could be cured if we all come together and work as a team, and that same care from Aim for Peace could be provided for the patient.
By recognizing the factors that most contribute to violence. Things like economic despair, lack of sidewalks, and vacant and abandoned buildings.
Be an example of what should be done.
Get people down at the table, discuss the issues on both sides, and try to come to a resolution and a conclusion.
Ask, how can I add calm to this situation?
Teaching our families and our kids how conflict resolution and restorative justice can play a huge part.
It takes the neighbors joining together to come up with the great ideas and strategies to make change.
Prevention is the best way to stop violence.
Violence can be cured by collaboration. One of the hallmarks of public health is that we bring together different sectors, looking at faith-based, looking at community, looking at youth. We're looking at how do we all together create a greater, healthier Kansas City.